Good afternoon, everyone. Welcome to Senate Education. Today is Tuesday, March 16th, 2:00 p.m. I apologize for the late start. We are going to start today by continuing our work on H81. We have Joyce Manchester from Joint Fiscal. Well, then Senator Hardy was in contact with a few of us regarding the miscellaneous education bill and a possible amendment to that. That she is going to be bringing in. And I apologize, Senator Chittenden, I'm not sure if she copied you on that or not, and I should have forwarded it to you. Just some language changes. And then we're going to have a conversation back to universal school breakfast and lunch. I had a conversation with Senator Starr this afternoon. They're likely, their timing, I don't think that bill will be on the floor this week. If basically from Senator Starr, take the time that we need to adjust things if we so choose. And we'll talk a little bit more about that. And then S114, this is the literacy bill. I put it on there for discussion because I believe we heard that Senator Kitchell might be interested in amending the task force. At least she put forward the idea of putting a librarian on there, and I didn't want to lose sight of that. So with that, Ms. Manchester, thanks for joining us. We appreciate your work on this. I know you've all been working on H81 and a fiscal note for a while now. And so with that, please take it away.
Thanks very much. For the record, I'm Joyce Manchester. Can you all hear me? Yes.
Yes.
Good. Joyce Manchester with the Joint Fiscal Office. And it's good to see all of you. I don't think I've met everyone, but maybe someday in person. Yes, so we were waiting for data in order to be able to do a fiscal note on H81, and we did get that data late last week. So I can share my screen if you'd like to see the fiscal note on the screen, or
I appreciate that.
Would you like that? Okay.
Yes, please.
Let's do that. Jeannie, do I have share screen permission?
Yes.
There we go. Are you able to see it now?
Not yet. There it is.
Yes, good.
Maybe a little larger if possible.
Let's see. Whoa.
Lovely.
Is that good? Okay. Oop. Okay. So the fiscal note regarding H81 really deals with just two parts of the bill. The first part is a change that is not so consequential in terms of fiscal effect, but that would make a small change to the operations of the Commission on Public School Employee Health Benefits. It would simply pay the members of that commission the per diem and the reimbursement of expenses, and the bill limits the number of meetings per year to 20 per year. So the appropriation would have to be about $35,000. The second change is a more significant change in terms of the fiscal impact. First, it removes the requirement that each plan tier, and when I say plan tier, I mean type of plan by family type. So a single plan, a two-person plan, a parent-child plan, and a family plan. It removes the requirement that each plan tier shall have the same premium responsibility percentage for all licensed employees participating and all non-licensed employees participating. So under the way things had been going, everybody, all employees were moving toward the 80-20 split. So the employer would pay 80% of the premium and the employee would pay 20% of the premium. And we'll see as I show you what the shares currently are, how that differs between the licensed employees and non-licensed employees. And the second piece of this change is that it removes the requirement that each plan tier shall have the same out-of-pocket expenses for all participating licensed and non-licensed employees. Okay, so we'll see a table in a few minutes that shows you more clearly what that means. The final piece of the fiscal note talks about future fiscal implications coming out of this second, more significant change. And of course, we can't really estimate what the fiscal effects will be until we know how the bargaining comes out. So what we can say is that state revenue needs and future employee-employer premiums will depend on the bargaining decisions made. The cost could be increased in future years if participating employees face less financial exposure to medical and pharmaceutical costs through lower premium shares and/or smaller out-of-pocket expenses. And what's going on here is that already we have rather generous health insurance plans for school employees. And we know that employees who do not pay much for healthcare are likely to use more of it, driving up premiums for all participants. Already the plans are more generous than most, as seen as in their actuarial value, and we'll compare some actuarial values later in the note. And premium increases have surpassed increases in the cost of care and enrollment. You would expect that as the cost of care, the price of all the inputs to medical care and pharmaceutical services, as those increase, you would expect premiums to go up. As more people are enrolled, the aggregate premium goes up, but you wouldn't expect the per person premium to go up. So allowing more leeway in bargaining could lead to even higher actuarial value and further exacerbate the incentive to use more services because the user pays so little. So we'll see some evidence to support those statements as we go through. And certainly I would appreciate it if people would speak up with questions. I know there's a lot going on when you start talking about health insurance plans. So if you do have questions, just speak up. I only see 3 other people on the screen. So
yeah, thank you for saying that. Please don't wait. No need to raise your hand. I can't see everyone either. So please.
I have a question, Chair.
Please.
If we want to go questions as we go through.
Yes, please. I think it's important.
On your 3rd paragraph, and maybe you get this later on, is where it says more generous than most. Already the plans are more generous than most. The most what? Like, what do you mean by that statement?
So I'm going to show you the actuarial value, which is a single measure that's a good way to look at generosity, if you want to use that word. It's the percentage of covered medical and pharmaceutical benefits that are paid by the plan.
Okay, and so you'll show that later.
And we'll see the actual numbers later, yes.
Okay, and then my other question is, and maybe you get to this later too, is the comments about exacerbating people to use more healthcare, but as part of the analysis that you want people to use more healthcare. It's kind of like the argument of primary care. Like if you don't do primary care because you're trying to save money, you end up costing the healthcare system more because you wait till you have to have surgery instead of going in before. So I wondered if there's a long-term benefit of having people use more healthcare services.
So I think what's being discussed here is using valuable medical services. So these are services that are known to produce good value. And when people don't pay anything, they are more likely to want more care, even if it's not shown to have real value in the healthcare system. So many MRIs, for example, are done without a really good cost-effective reason for doing them. Because people hear about MRIs and they think, yes, MRIs must be a good thing. And so I'll have one, even if it's not going to tell my medical providers anything new. So it's that sort of thing that could be changed. It's also generic drugs rather than brand name drugs, even if there's no good evidence that the brand name drug is more effective. It's things like that. So you really need people to be engaged in order to ask questions so that they're not consuming more medical care than is necessary, more than would be a good idea.
Okay, well, I don't want to drive too far into Senator Lyons' committee. They can hash it out in there, but it seems like it's not a question for the individual, but more for the providers. I mean, maybe but that's my uneducated view, is that it's more often the providers that might be trying to say, oh, you don't have to pay anything, so let's do an MRI, more than people asking them, but I could be wrong, but that's just my comment.
It's complicated.
Okay.
Can I ask a question?
Yes, and then Senator Hooker, I believe, has her hand up.
Okay, go ahead.
Senator
Thank you.
Hooker?
I just wanted to follow up on the type of plans, Joyce. And are these compared to like the plans that are on the exchange, the generosity of the plan? Are they any different from the plans that are on the exchange?
We're going to talk about that in a little while, and we'll see the actuarial value and so forth. So we'll be talking about that in more detail.
Thanks.
So, but there's no, you probably won't have a comparative analysis with any of the self-insured folks.
I've been looking actually for actuarial values on the state employees plan, and I haven't yet found them. They must exist out there somewhere, but I haven't
They
yet
do.
found them.
I think Nolan Langwell presented them to us a bit ago.
Is that right? Oh, good. I will.
Yeah, it's
bug
a
Nolan.
while ago. It might be even a couple of years, but
Okay, that's good.
or the VSEA themselves may also be open to that.
Okay.
Ms. Manchester, I just want to confirm, the House has not seen this. That's accurate. The House voted it out without the fiscal note?
That is correct. I had written a memo
Okay.
that was beginning to get at some of these issues, but
I see.
it wasn't this advanced, shall we say.
Thank you.
Okay, so I think we can take care of the commission appropriation pretty quickly. I've already talked about the fact that there are 10 members, there are 4 alternate members, the per diem is $50, the expense reimbursement is 76, it's actually 76.25 per day, 20 meetings per year, so it's a straightforward calculation to get to $35,000. Okay, so now let's move on to the commission duties regarding premium responsibility percentages. So you all know that VHI, the Vermont Education Health Initiative, is a nonprofit organization that provides health insurance plans to school district employers and employees. You may know that it does have some private school employees and employers who use their services. I have taken out any premiums paid by those private schools. So when I'm talking about premium amounts, I'm just talking about the private school. I'm sorry, I'm just talking about the public school employers and employees. There's a collective bargaining agreement, or what we call a CBA, that's now in effect through December 31st, 2022. All licensed employees under that CBA, and when I say licensed employees, I'm talking about teachers and administrators who have to have licenses. All licensed employees pay 20% of the health insurance premium for the VHI Gold CDHP and Silver CDHP. I'm not sure what that is. The employer pays the other 80%. For employees enrolled in VHI Gold or Platinum plans, so these are higher value plans, the employer pays the 80% of the premium. No, I'm sorry. The employer pays the equivalent of 80% of the gold CDHP. So they don't keep going up forever and ever. They pay a set amount towards those higher value plans. Now, for non-licensed employees in 2021, they pay the premium share for the various plans according to the status quo. So this is what was bargained previously before this current CBA. On average, the median and mean share of those premiums paid by year-round non-licensed employees, such as support staff, was about 15%. And for school year non-licensed employees, the mean and median was about 15%. Okay, so those, I'm sorry, 16%. It's hard to read the screen. Okay, so those premium shares paid by employees are definitely lower than paid by the licensed employees, the teachers and the administrators. So the current CBA did not impose changes for 2021. They kept the status quo, so those shares are still in effect. In 2022, the CBA requires the employee share to increase up to 2 percentage points to move closer to 20%. So the employee share cannot go over 20%, but it has to increase by 2 percentage points towards the 20%. And this is in keeping with the idea that was in vogue, 4 or 5 years ago when the statewide bargaining first came into being as an idea, that all employees would move to the 20-80 split, 20 for employees, 80% for employers. Okay, so here's a table that just shows you what's going on here. Let's see. So this shows you the employee premium share in the current CBA, which ends December 31st, 2022. And then on the right, you can see calendar year 2023 in the next CBA, and we don't know what will happen. But if this bill goes into effect, each of these tiers for both the licensed employees and the non-licensed employees could be bargained separately. So all the different tiers could have different percentages for the premium to be paid by the employee. I think the top of the table is quite clear. All licensed employees pay 20% of the premium, regardless of the single, two-person parent, child, or family plan. And that holds true in both 2021 and 2022. For non-licensed employees, it's locally determined according to the status quo in 2021. The average is about 16% for the school year employees. And next year, in calendar year 2022, it's whatever the locally bargained share was, plus 2 percentage points to move toward the 20%. Okay, and again, all of those tiers could be bargained separately if this bill becomes law in 2023.
So this is regardless of income.
Yes.
It's just this increase. And then are you going to talk about co-pays and deductibles out of pocket?
So there is no copay, and the deductible we'll get to in just a minute when we talk
Okay.
about the HRA. Yep.
So
Okay.
Joyce,
Sorry.
could I just ask, like, what's the lowest percentage that somebody might be paying, an unlicensed, non-licensed employee might be paying?
So I don't know that answer. I have not seen all the individual contracts,
Okay.
so I don't know. If both the median and the mean are the same at 15 or 16%, that tells you that there's not a whole lot of variation going on. Okay, so negotiations will begin this April 1st to determine premium shares in the next CBA that become effective in January 2023. And as we said, this bill would allow bargaining for all the different premium shares across different plan tiers and across licensed and non-licensed employees. So I didn't have any numbers to go on. So what I did was to simply say, okay, if the premium share changes by 1 percentage point, how much money would that be for the state and for employees? We know that the total premium paid for public school plans is about $250 million in FY22. Applying the average rate of VHI premium increases from FY19 to FY22 suggests that premiums might increase 11.3% per year between FY22 and FY24. So you would get to premium costs of about $311 million in FY24. And again, these are projections. We don't know that they'll come true. But if that's true, then any 1 percentage point shift in the premium share of all participating employees represents $3.1 million. So if the share went from 16% to 17%, and the share went from 20% to 21%, in other words, all employees got 1 percentage point more, then that would be a shift to $3.1 million, right? That the employees would pay, and $3.1 million less that the state would pay the employer. And of course, if the premium shares go down by 1 percentage point, that means that the state pays less, the employees pay more. And then I separated the participating employees who are licensed from those who are non-licensed. So if only the non-licensed employees negotiate a 1 percentage point change, the shift would be about $1 million. They make up about a third of the premiums paid. Are we good? Move on to the out-of-pocket expenses.
May I make a question? I have a question, Chair.
Please go ahead.
So I'm not sure if you can answer this, Joyce, but you seem to have used the word generous. So you've done some comparisons to other plans. I've heard in this discussion of H81 an argument that against some other language that would set a higher threshold of consideration for cost, because the argument against it was that it would be out of step with our statutes for municipal negotiations and Vermont state employees negotiations. My question to you is, using that same standard of trying to gain consistency with other negotiating statutes that we have with other labor unions, could you tell me, do you understand if the VSEA and other municipal statutes don't allow for this tiered bargaining that H81 is now permitting? Or is there no real direct comparison with what this is proposing relative to the other statute regulated labor unions?
So I don't know the answer to that question, but I'm happy to investigate.
Thank you.
Okay. So we're moving on now to the commission duties regarding out-of-pocket expenses. And the bill would strike the sentences that say that the out-of-pocket expenses have to be the same across all tiers for all employees. So right now, the employer contribution to a health reimbursement account for each gold CDHP plan differs for non-licensed and licensed employees. And I hope you all know what a health reimbursement account does. It helps to pay the out-of-pocket expenses. And for the school employees plans, the health reimbursement account pays out-of-pocket expenses for covered benefits beginning with the first dollar. And that's really significant. It means that the first large bunch of medical services and pharmaceutical services that you obtain comes with no out-of-pocket expenses for you, because you have a health reimbursement account financed by the employer that is going to pay those out-of-pocket expenses. Okay.
So Joyce, do we have historical data on what that might be? Do we have any school-based data as to what those first dollar expenses might be? Is there any? And I guess you'd have to look at it through the claims database. I don't know.
Right. So I think maybe you're asking how many employees actually have to pay something out of pocket after the health reimbursement account runs out.
That's the opposite of what I was asking, but that would probably answer it equally.
Okay.
Fine.
Okay. Right. So I have no idea. And
Okay.
I think you're right that we'd have to go to the claims database in order to figure that out.
Yeah. So, I mean, I wonder, we could do that. But we won't right now.
We miss Chloe Wexler. She would be the person who would dive into the claims database and really like doing it.
Who is that?
Chloe Wexler.
Oh, yes, Chloe. Yeah, she was in our committee the other day. Maybe we could do that.
Well, you know that she no longer works for JFO.
Yes.
Very sad. Yes. Okay. Okay, something to think about for the future. Okay, so for licensed employees in the gold CDHP plan, the employer, the school district currently contributes up to $2,100 for medical or pharmaceutical out-of-pocket expenses for single plans, and up to $4,200 for the other tiers, so all the other types of plans. Employees in single plans pay the last $400 of out-of-pocket expenses if needed, and those in other tiers pay the last $800. For non-licensed employees in the current CBA, the employer contributes up to $2,200 to the HRA for single plans, up to $4,400 for the other tiers. And non-licensed employees pay the last $300 in single plans, the last $600 in the other tiers. So current law does not specify the amount of out-of-pocket expenses in future years. The bill, once again, allows statewide bargaining over out-of-pocket expenses across tiers and licensed, non-licensed employees.
Joyce,
Yes.
if it's okay, Chair, a question on what happens after both the HRA payment and the employee pay? So like on a single licensed employee, what if they have over 2,500 in
So then
total?
that's the employer responsibility.
It goes
again.
back after the last $400
Right.
goes back to the employer.
Right. So the plan specifies a maximum out-of-pocket amount, which is $2,500 for single employees. So the HRA pays the first $2,100 if you're licensed. You pay the next $400, and then the individual's off the hook. So it's the employer,
Okay, thanks.
or I should say it's not the employer, it's the plan, right? The plan takes up the risk, right? Okay. Right. So the bill would allow statewide bargaining over those out-of-pocket expenses across tiers. And what I did was, once again, use an illustration of an increase in $100 in the maximum employer contribution for all subscribers with health retirement accounts. Now, maybe this in part answers Senator Lyons' questions, because the understanding is that that's about $75 of actual payment. So if you promise an extra $100, it would actually cost the employer probably an extra $75. Okay. Now I somewhere I have a footnote. Oh, I see the footnote that says, here's the footnote, that school districts actually have to book the entire $100 increase for the calendar year, just in case more employees use more healthcare and they have to pay the money out the door, right? But when it's all settled in the end, it usually ends up being about $75 of actual payment. Yes, and it does have to be used within 12 months. I don't think I've said that yet, but that is true. Okay, so
Okay, so wait, hold it. So it has to be used within 12, is that, but then the reserve amount, so the $25, would that carry forward? Is there a restriction on?
I believe that is the school district's money that they've put in that they didn't have to spend, so that could
Right.
carry over, right?
Okay, but there's no requirement that $25 gets used within the
No, no,
12-month period? Yeah, okay.
No, no.
all right.
No. Okay, so I looked at actual HRA take up in calendar year 2021. And the employer, the state, would pay out almost an additional $1 million if all enrollees with HRA accounts were promised an extra $100 in HRA contributions. Okay. If that offer were made to licensed employees only, the additional cost to the employer would be about $620,000. If made to non-licensed employees only, the additional cost to the employer would be about $350,000. And differences among plan tiers would result in smaller increased costs if limited to single plans, obviously, and larger increased costs applied to other tiers that have more people in them and have a larger out-of-pocket maximum.
Joyce, did I miss something? When you're talking about the additional cost to the employer, what is the scope? Who are you? Which employer? Is this a statewide number?
Yes.
Or is this, okay,
Yes.
all right,
Statewide.
thank you.
Right. So this is telling me that I have to go to a meeting at 3 o'clock, and I apologize in advance that I'll have to jump off this meeting. But you will appreciate it. It's the steering group for the Select Committee on the Future of Public Higher Education in Vermont. Okay. Yes. So I do have. There we go. I do have a table that will illustrate once again what I'm talking about here. No, I don't do Okay, so there's the employee responsibility for out-of-pocket last dollar spending in the current collective bargaining agreement and the next agreement starting in 2023. So here you can see clearly what I'm talking about in terms of licensed employee by tier, paying $400 in single plans and $800 in 2 or more person plans. And for non-licensed employees, single people are paying $300 last dollar out of pocket. 2 person or more plans are paying $600 out of pocket. And you can see the statewide amount is undetermined because it hasn't been bargained yet. So are there any more questions before I go on to the implications section?
I just want to clarify that the $620,000 in the previous paragraph and the $350,000 together are, just shy of $1 million statewide as increased costs for the access to these insurance plans.
The extra $100 contribution by the employer
Yep.
to the HRA. Correct. And you can see the additional $1 million is right in the middle of that paragraph. Yeah.
Yeah. And so then the other question, the question becomes, what's the history? Again, going back to that, what's been kind of the utilization rate for those plans that might have incurred, used up the entire HRA? So what additional demand would there be?
Right. So I don't know the answer to that, but we do know
Okay.
on average, people are using 3/4 of the HRA contribution. So that tells you quite a lot about utilization.
Okay, thank you.
Okay, so now we go on to the implications section. And the issue here is that it's not, if you increase the contribution by the employer to the premium or to the health reimbursement account, it's not just a 1-year additional cost to the state, because it also influences the utilization of healthcare. So as people face smaller and smaller costs for their healthcare, they tend to use more healthcare. And we see that very clearly in the rate filing by VHI, which is public. Each year, the actuaries look at the increase that is being asked for by VHI in terms of premiums, and they try to parse out where those increases are coming from. So, for example, they look at enrollment. So we're talking about aggregate premiums going up, let's say, $1 million. Well, how much of that $1 million is because you have more bodies being covered by the plan, right? And you may recall that this year, there was an increase in eligibility. School employees who work 17.5 hours or more were allowed into the program. And so there was an uptick in enrollment. So in many years, you can explain part of the increase in premiums by looking at the increase, I should say, in aggregate premiums, by looking at the increase in enrollment.
So was
Another-
that 17.5 hours, was that a negotiated agreement to increase that, or?
Let's see, I believe that was in.
You don't have to answer right now, but it'd be good to know. I mean, I personally would like to know it. Then the other,
I do have an answer, sorry.
okay, good.
I believe it was in 16 VSA section 2103 that established the commission that said
Okay.
starting January 1st, 2022, eligibility will expand to include staff with 17.5 hours per week or more. And
Can I
there
ask
was
one
a-
more question?
Sure.
Please.
I interrupted you, I'm sorry.
No, please go ahead.
I was just going to say that we have seen at least the initial effect of that eligibility increase, because we could see the enrollments for January 2021. I was able to get those from VHI.
Okay. Another question regarding VHI. Are the provider payments made as value-based payments? Is there anything in statute that requires a value-based payment? Or I think, yes, there is adherence to the all-payer model, or is that just VSEA?
Boy, oh boy, I am not the
Okay,
the
it's
healthcare
okay.
expert.
You don't have to answer that. If there's not an answer, I can get it somewhere else. But
I could certainly ask Nolan if he knows the answer to that.
okay, yeah, he will.
I remember that it was a big deal when the state employees joined the
Yep.
ACO, and I'm not remembering that the teachers joined the ACO, but
I don't think they did. There was, yeah. Okay.
okay. So I'm now moving on to the implications section, which says that the annual cost of reducing employee premium shares by 1 percentage point or reducing employee out-of-pocket responsibility by $100 may not appear to be very large, but the follow-on implications of such changes can be consequential for premiums in future years. And I'm going to try to lay out that case here. We talked briefly about the fact that utilization of healthcare depends in part on the exposure of individuals and families to premium contributions and out-of-pocket expenses. The smaller the premium contributions or out-of-pocket costs, the more healthcare people use. And you can see I have a footnote here that talks about the rate renewal announcement, HRAs, and this was stated explicitly by VHI, HRAs with first dollar coverage, no rollover provisions. In other words, you have to use the HRA in one calendar year or it's gone. And high funding ratios. So if you think about the non-licensed employees, no, stop. Okay. If you think about the non-licensed employees, their funding ratio is 88% in the HRA. So all those things together led to higher utilization than anticipated and the need to raise premiums in future years. So this is something that's stated by VHI. This is not, do we think that utilization depends on out-of-pocket and premium? This is what the actuaries are seeing based on what they know about changes in enrollments and changes in the prices of inputs to healthcare. So going back up to my writing here, the more a consumer has to pay for services, the more likely they are to ask questions and to avoid excessive healthcare services. So according to the actuaries, 1/3 or more of VHI's double-digit increases the past 4 years was not tied to rising prices or enrollment, but is attributed to the HRA covering a greater share of out-of-pocket expenses, which resulted in higher use of healthcare services. Okay, so that's coming straight from the rate renewal announcement and the rate filings.
So this is a fee-for-service world, and so this is demonstrated through data.
Yes.
Okay.
Senator Birchlick?
Yeah, I mean, I clicked on the link and I'm looking at that. I don't see where it says that. So maybe it's just something I can get from Joyce later. I don't see that in this announcement of the January 2018 final rates, this FY19 health plans. I don't see where they say what was just said.
Sure, I will check on that. I had a lot of sources helping me out, so it's quite possible that I mixed up something. I will check on that.
It could be a different document where they say it, not that document. But.
Yeah, right. I will check on that. Thank you. Okay, so that is looking at the relationship between exposure, financial exposure for the individual and utilization. But there's another avenue that we have to think about, and that is that greater utilization of healthcare also causes VHI to increase its reserve target. So VHI sets a reserve target for itself. They are self-financed, self-insured. They set that target at 15% of expenses. So when utilization goes up, they have to increase their reserves. And that means in order to pay for that increase in reserves, they have to increase their premiums charged to members.
Senator Lyons?
Oh, I was just going to say that increased utilization does not necessarily have to be considered a negative. I mean, when we say that, we make the assumption that there's overutilization. So it's a question about what exact, what's the what are the quality-based outcomes, and where is the utilization happening? So it's a primary care. We're seeing more people get some of their wellness visits. That's a good thing. So I'm always careful about making categorical statements. And you're quoting somewhere something, so it would be interesting to know exactly what's going on. And again, maybe it's the claims database is the only place to know that.
Right. So let's move on and look at the actuarial value, because I think that's probably the best summary measure to talk about well, there's probably a different word to use. I'm thinking about how generous the plan is and how the out-of-pocket expenses differ across these plans. So the actuarial value was reported in the rate filing for FY 2022. And you can see here in table 3 that for the gold CDHP plan, without taking account of the health reimbursement account, the actuarial value was 84.4%. But once you add in the HRA, for licensed employees, the actuarial value jumped to 97.5%, which is extremely high by anybody's measure. And for non-licensed employees, it's 98.1%. So what that means is that on average, think about all the people who are using healthcare under this VHI Gold CDHP plan. On average, the non-licensed employees were paying 1.9% of the cost of their healthcare, and the licensed employees were paying 2.5% of the cost of their healthcare. Now, just as comparison, the gold plans on Vermont Health Connect have an 80% actuarial value. So if you were to go to Health Connect and buy a gold plan, you would be getting a plan in which you would on average pay 20% of the cost of your healthcare. I tried to look at some average actuarial values for other Vermont plans. As I said, I have not been successful yet, but maybe I haven't been looking in the right places. If you look nationwide, the typical preferred provider organization PPO plan sponsored by employers paid 83%. So it has an actuarial value of 83%. And it's also worth noting that most people have seen sizable increases in deductibles over the last 10 or 15 years. Those deductibles have been going up, and the average was about $800 in 2017. They've probably gone up further since then. So I think I've shown a number of indicators here that says that the teacher's plan has a really high actuarial value and very low out-of-pocket expenses right now.
When you talk about a comparison across the country for the different plans, are these public plans? Are they education, or are they just all plans?
The one that I'm citing here is a PPO plan sponsored by employers. So I don't know that they may include teachers, but they most certainly include lots of private employers as well.
Okay. Well, I mean, the fact is, if they're including private employers and they're lower, that's probably says something. Right.
If I may, Chair.
Please.
Joyce, I know you need to run, so I do appreciate this. This is very, very helpful to walk through. Healthcare is extremely complex. I'm trying to reconcile your use of the word very generous and generous with what I'm now seeing. We're striving for 80% payment by employer, but then you just said that the nationwide average is 83%. No?
I'm sorry, those are two different concepts.
Okay.
So the 80% paid by employer is the premium share. So if you think about the premium for a month for your healthcare plan, the employer in this case would be paying 80% of the premium, and you as the employee would be paying 20% of the premium.
Yep.
Now, in this last paragraph, I'm talking about the actuarial value, which remember is the percentage of covered health and pharmaceutical benefits that would be paid for by the plan.
Okay.
Okay. So it includes the value of the health reimbursement account in paying for some of those services.
Can I ask one more question?
Please.
So, Joyce, the by statute, can you give us kind of the list of what is required? So, is it the 80/20, the HRA? What is actually required by statute, and how much of what we're seeing here is negotiated or has been negotiated?
Right. So in 16 VSA section 2103, what it says is that the commission will negotiate both the premium shares for employers and employees and the out-of-pocket responsibility for employees and employers. And as it stands now, it says that all employees will have the same premium shares, and all employees will have the same out-of-pocket responsibility separated by single and well, it doesn't say separated by single, but in the status quo, single plans pay less than all other plans. So it's assumed that that would continue. So the change in this bill is that it says we're going to strike the requirement that all employees face the same premium shares and the same out-of-pocket responsibility. So this opens up the possibility that licensed and non-licensed employees could have different parameters, and that across all tiers, you could have different parameters. So it opens up more possibilities to bargaining. And just to give a little history, of course, when the gold CDHP plan, I know that's redundant, but when the gold CDHP plan was first introduced way back in 2016, 2015, 2016, 2017, the idea was that it would be 20/80, 20% employee, 80% employer, and 2,500 maximum exposure out of pocket, with the HRA paying the last dollar, 2,100 for single plans and 4,200 for family two-person plans. And so things have been locally negotiated and have really moved in the other direction that has allowed utilization to grow much faster than expected by the actuaries and has led to the double-digit premium increases over time.
Senator Chittenden.
I'll just say this. I'm wondering why Senate Ed, but I'm the new guy. It's a new guy question. Is Senate Ed is diving into contract negotiations and healthcare issues that have major financial implications for the state. Are we the last stop for H81, or is this going to go to finance or to Senator Lyons's healthcare? Does this fit in other committees' jurisdiction beyond education?
It's an excellent question. It was not in the Education Committee in the House for any. If it had been, it was there for a moment. It ended up probably here. I know this committee looked at these issues last year and passed out a bill, as Senator Perchlik knows. I I know that it's going to go to approps. I would think at this point, just reading through things, that I wouldn't be shocked if it made a stop in finance as well. And then I would look to Senator Lyons to, if she is interested in the bill, she is more than welcome, of course, to take it in.
No, I think it rightfully belongs in finance. There's no question about it.
Yeah.
Our committee would love to dive into it. I can't see Cheryl, and I can't see Senators Terenzini and Hooker right now. I can see they're all excited about having it in committee, but unfortunately, I think it belongs in finance. So that's probably where it will go.
Yeah.
And having been through a lot of this, it is a pretty exciting place to be, and to think about what we can do to improve access, and also quality outcomes, and reduce costs. I will say that one recommendation that our committee might very well make, which is in our jurisdiction, and that is the issue around all payer value-based payments and within the ACO, and it would make a whole lot of sense to integrate. And I'm sure there are people out on YouTube now who are cringing when I say this, but it would make a whole lot of sense to have this integrated in with VSEA and others in the all-payer model. It makes huge sense. So that's something maybe our committee will look at.
Okay.
But the bill doesn't need to be in our committee.
Senator
honestly.
Persley.
Yeah, Chair Campion. I think it's a good point that Senator Chittenden brought up, because if you really tried to figure out the cost, you'd also have to take the whole bargaining into context, because this is just one side. Maybe there's a savings because they reduce some other benefit to increase healthcare. So it's a tough fiscal note to write. I think GFO has a tough job when people ask for a fiscal note for something like this, because there's so much in play that, it's good to see some basics like this, but I don't know if we really have much to go on, really.
I just want to say I'm really glad to hear that Senator Lyons and Senator Perchlik are seeing the value for finance. I'm really struggling to understand the implications and healthcare in general to weigh in thoughtfully on what this JF note is telling me. This JFO note is telling me.
That's fair. It has nothing to do with being the new guy. I can assure you. It's as we've dug in and learned more, I think I too am making my way through this. Let's leave it at that. Any other questions at this point? Joyce, you have some more?
No, I am finished.
Okay. Okay. If you don't mind removing that from the screen so we can see folks. Great. Good. Senator Hooker.
I'm just thinking that I don't want to lose sight of, the kind of equity issue and having people who are making a whole lot less money paying the same percentage for products. So as much as I understand the implications of the fiscal note, I still don't want to lose sight of that.
Sure. Yeah, I think, Senator Ballant was checking in a little bit, and we'll check in later on this in terms of its path, and also with Senators Kitchell and Cummings. But there does seem to be a genuine, we can certainly move something, understanding if senators are comfortable, understanding where it may go next. And that, I think the big question needs to be finance, and that is where this seems to need to be. Ms. Manchester, thank you. We may have you back as we make our way through this, but for now, I think we will leave it there.
Thank you very much.
Mr. Fannin.
If I may have a minute or two just to respond a little bit, because I think it's worthy of resetting the table a bit.
Sure.
So this isn't a healthcare bill. This is a education bargaining bill. And that's how the bill started, because it was dealing with education and bargaining. It started in Senate Education Committee last year. For various reasons, workload, I'm sure, among others, in the House. It ended up in the House General Committee and then came back here to your committee this year. So currently, as it stands, teachers and support staff do pay different amounts for, based on Act 11 from 2018. So that's permissible under current law. And then the change in Section 4 of the bill, it simply gives voice to the hourly employees about how much they pay in premium or out of pockets. So it doesn't require anything. It just merely continues what they're doing now, which is paying a different rate, and have typically forever. And as with every other, Senator Chittenden, you asked the question about other state bargaining laws, the municipal law and the State Employees Labor Relations Act all don't prescribe how much people pay in healthcare premiums or out of pockets or anything of the sort. So this would just be bringing this law into line with every other bargaining law in the state. And frankly, sure. Senator.
On that, Chair.
Please.
So, Mr. Fannin, so could you clarify that? So, Vermont state employees, do they also have different tiers that they negotiate for? Or do all Vermont state employees have the same general healthcare bundle that they negotiate for as a package across all licensed, unlicensed, or statuses of employees?
So my understanding is, and I don't represent the state employees, but my understanding is they all pay the same. The difference is, though, the law doesn't require it. It's what they discussed and agreed to at the bargaining table. So it may be that, we go there and everybody pays the same amount in the next round of bargaining, but requiring it as a matter of statute, as a matter of law, as this one would currently be, is different than every other bargaining law. So that's the distinction here. The state employees don't have it required, but I think they all do pay the same amount. But that's been long in the coming. And frankly, as the folks of you here on the Senate Health and Welfare Committee know, healthcare is expensive for everybody, and this is no different. But this bill is not a healthcare bill, as I said, and healthcare is complicated. And I'd like just a few corrections to Joyce's memo, and I think it's too bad we didn't have a chance to speak beforehand, Joyce, because I think some of this is easily corrected. So. In the third paragraph of the fiscal memo, where she talks about employees using more or driving up premiums or care, I'm not sure there's any evidence to support that. And in fact, what VHI is showing in a report from 2019, I think it was, that said that the largest driver is in fact cost, and the largest cost driver nationally is the cost of care. The Kaiser Family Foundation put out a report in September of 2020 that analyzed all the OECD countries, and it in fact said healthcare costs are driving the cost of healthcare, if you will. It's not utilization. I used to be the general counsel of BISCA in the Healthcare Administration. I was the general counsel there in 2000, 2001, and the largest the number of users who use the bulk of the healthcare are a small number. Now, some would say 80-20 or 90-10. It's about 10% of the population, if you will, use about 90% of the care. And they use it because they have to. They're very sick, they have chronic conditions, and nobody's using healthcare, just for kicks and grins. It's just not at all in any evidence out there. People use healthcare because they need it. Their doctors recommend it. When I was at the Healthcare Administration, for example, the MRIs were coming on board, and the hospitals were asking for MRIs. Why? Because the med students weren't learning how to read X-rays. They were only learning how to read broken bones on MRIs. So then the hospitals have to follow. That drives up the cost of care, if you will. An MRI is certainly way more expensive than a radiology shot. And my mother-in-law used to be a radiology technician in St. Albans. It's a simple procedure, but if the med students aren't learning how to see it and use it, they're needing an MRI, and then the hospitals have to respond.
Just pause there for a moment, please. Ms. Manchester, I don't know if there's something you want to say.
Yes, please. I need to jump off in just a minute, but
Right.
I do want to say that, yes, absolutely, the cost of care is driving up premiums as the primary factor. But the rate filing from FY22 from VHI is very clear that the cost increases account for a certain percentage. The enrollment increases account for a certain percentage. And then there's another bunch of cost of premium increases that are not explained by the first two factors, and they are attributed to utilization increases by each person enrolled in the healthcare system on average. So I'm absolutely not disagreeing with anything that you said. I'm just saying that there is evidence. There is absolutely evidence that says that utilization is going up faster than expected by the actuaries. And this is attributed to a lower share being paid out of pocket and a lower share of premiums in the VHI plans.
Okay. It's a great conversation. I think the rate was 9.8% was the increase. I think it's about 1.2% of what we're talking about. So that's my understanding. So it's a good conversation to have in the health and welfare conversation. But again, this is not a healthcare bill. So it's a bargaining bill, and it's just designed to lay out the rules of the road of bargaining that begin April 1.
All right. And actually, I'm going to leave it there, Mr. Fannin, because we are hearing some concerns about others that would like to be in this room if you were going to be in this room. So which I think is fair. We know we have a conversation going forward. But for today, we're going to leave it there. We're going to take a break until 3:15, at which time we will hear from Senator Hardy with her proposed language amendment on miscellaneous education. So thank you both for being here.
Thank you.
And we'll talk to you soon. Good afternoon, everyone, and welcome back to Senate Education. It is Tuesday, March 16th at 3:18 p.m., I believe. We are joined now. We are returning to miscellaneous education, which those of you who are following our work contain three main components, one of which Senator Hardy is going to put forward an amendment for the committee's consideration. Thank you, Senator Hardy, for being with us, and we'll give the floor to you and Mr. Desmarais.
Excellent. Thank you, Senator Campion, and thank you to the committee. First of all, thank you for doing this bill and including all the things you did in it. I love this bill, so much appreciated. My amendment is on section 11, which is the menstrual products portion of the program. And a few of us were emailed early in the session by a mom who has a non-binary child. And so I've been working with her and a couple other moms, and also checked in with my teenage kids about the language to make sure that it's, gender neutral and appropriate for, how things work in schools for this age group. So the amendment, Jim, did you give it to everybody, or should I send it, or how?
I can bring up on the screen if you want me to.
Okay, sure. It's pretty small.
It's a very short amendment. That's true.
It's short.
Yeah. Here we go.
Senator Hardy, Mr. Desmarais is bringing that up. We had heard from a parent early on, probably the same parent. Did we not include, were there some revisions made to what that mom sent? Or did we miss something that was in there? Because we did try to address everything.
Yeah, you addressed part of her concerns, but not both of her concerns. She had two concerns. You added the language about the school nurse's office.
Yes.
Which was one of what she was concerned about, to make sure that students continued to have the option to be able to go to the school nurse,
Yes,
get the products. So that was great. And the language I'm changing, just to be completely clear was the language that was in the original bill that was mine and Senator Lyon's bill. So I take full responsibility for it. And so I'm just amending my own language. The first one is on line 8, and it just removes the words "the embarrassment of." And this actually came from a suggestion from one of our colleagues, Senator Rahm, who suggested that we don't want to imply that menstruation should be embarrassing. Even
Excellent.
though it sometimes is embarrassing for young people in school, we don't want to assume that it is or that it should be. It's not something people should be ashamed of. It's natural. So that's one thing that I would amend in this. And then the second part is on line 7 through 8, and it just changes the language a little bit. So a majority of gender neutral bathrooms and bathrooms designated for, I changed from females to female students. And that's actually just to make it more grammatically correct. Female is an adjective that is modifying students, and using the term females often sort of sounds like you're talking about maybe female, the female dogs instead of female students. So just to make it a little bit more grammatically correct, and then generally used by students in any grades 5 through 12 rather than female students. So this is getting to the gender neutral, that there are non-binary or even males in some male students in some cases who may menstruate. So this is making it gender neutral. And then again, down in this next section and the third instance of amendment, it does basically the same thing. It changes, if you can scroll down a little bit, Jim, changes from just the section on line 14, changes designated for female students. So those are the three, I think that's all the 3 areas, or there, I guess technically 4 places where it's amendment, but 3 instances of amendment. Is that correct, Jim? Did I get them all?
That's correct.
Yeah.
That's correct. Yep.
So that's it. They're pretty small, and it's just wording, and it doesn't really impact the intent or the actual what the bill's doing. It's just to clean up a little bit of the language.
Great. Jim, if you would remove that, that would be great. And we will have a committee discussion. Any questions for Senator Hardy on that? Seemed very comprehensive and thoughtful.
Great. Well,
terrific. So Senator Hardy, I'm pretty good at reading the committee. And I'm optimistic that this will pass. So if it were to, we will look to you to get a copy to Mr. Bloomer today.
Yep.
It would be nice for it to appear in the calendar tomorrow, and I know he's still putting that together. I think that is it.
okay.
Anything else with Senator Hardy? We'll also look for, of course, your full support and endorsement of all of our work on the floor.
Of course. I have questions on a couple of your other bills, so you may see me back later this week. But I really appreciate all the work you guys are doing. It's really great work, and I love coming to see you. And just let me know how things go with this, and I will send the amendment to the secretary. Thanks, everybody.
Thank you so much.
Good to see you all. Take care.
You too. Okay. Okay. Do anyone like to make a motion to take that amendment and approve it as presented by Senator Hardy?
So moved.
Thank you.
So move.
Thank you. Moved by Senator Hooker. Any discussion?
Just that I don't know how amendments work, but I'll figure it out tomorrow.
Nope, it's an excellent point. We will cover that as soon as we take this vote. Seeing no other discussion, Senator Persick, would you mind? Actually, can we just say all in favor of moving Senator Hardy's amendment as written? All in favor?
Aye.
All opposed?
501.
501, one absence. Thank you. So, Senator Chittenden, tomorrow, I would recommend if you have, look at the calendar. If you have any questions, you can talk to Secretary Bloomer, but basically after your presentation or even during your presentation, I would recommend that indicating that there is an amendment in the calendar and that that amendment is coming from Senator Hardy and that she will present the amendment. After which point, after she presents the amendment, you'll be asked to give the committee vote. And you'll say, of course, that the committee's vote is 5-0-1 in favor of the amendment. And I think that's it. Mr. Demarais, am I missing something? You hand up or?
Nope.
Okay.
The Lieutenant Governor, the President of the Senate will kind of choreograph it. You don't have to do too much.
Yeah.
If they're aware of the amendment, they'll be ready for it, so they'll call on Hardy for it.
Yeah. Okay. Thank you. And Mr. Demarais, is it safe to say you'll now email Senator Hardy with the clean copy?
She's got that already. So she has to give that to Secretary Bloomer for the
And
calendar.
who notifies her of the vote?
I think your clerk would.
Okay, Jeannie, if you would please email. Oh, I'm sorry, Mr. Senator Perchlik, if you would please email or notify Senator Hardy, that would be much appreciated. Okay.
Just of the vote, not of the, she already has the amendment, right?
She has the amendment. And I believe she knows she needs to just get it up to Secretary Bloomer. Very good. Okay. Thank you. One final thing I just wanted to put on the table. We don't need to spend a lot of time on it today, knowing that people are busy with floor reports and other things, but we did hear two proposals, one from the Agency of Education and then one from Jeff Francis of the Superintendent's Association as it relates to S100. And I said, as I mentioned at the top of the meeting, we do have time to work on this. I don't think it'll be on the floor until next week. What Mr. Demarais was kind enough to do was just to put their ideas into the bill, into a drafted that highlighted their suggested changes. We can have, I'll put on the agenda for tomorrow a more in-depth conversation, if you will, but I thought it would give senators an opportunity just to see on paper and to review what was discussed last week. And then we can talk more tomorrow. So Mr. Demarais, well, with that, if you don't mind, bringing it up and we'll
Sure.
look.
Yep. Okay. So for the record, Jim Demarais, Legislative Counsel, we're walking through a draft amendment by the Committee on Appropriations on S100. And it does two things. It incorporates the agency's request for some changes in the language around use of federal funds and definition of poverty and reporting. And secondly, it incorporates the testimony.
Jim, I'm sorry to interrupt. Are your changes in yellow?
Yes, there will be.
Yeah.
Yep.
Okay, great. So I haven't seen them. Great. Okay.
Yeah. And the second thing it does is to incorporate the testimony you heard last week from Jeff Francis, which recommended a change of funding away from school budgets into a state source. So with that in mind, the changes begin here. So we're in the statute on award of grants. And what C1 does, it's not changing the language. I just put the 1 here, so I could add language here on 2. But 1, by way of reference, is authorizing the state to pay for reduced price lunches, not free, but for reduced price lunches. There's a part that is payable by the student or by the family, and the state picks that cost up. So that's what C1 does as existing statute. That's not changing. 2, though, is new, and it's where the state would pick up the cost of basically universal meal. So it says on a quarterly basis from state funds appropriated to the agency for this subsection, the agency shall award to each school district a sum equal to the amount necessary to reimburse the costs of meals actually provided in the district during the previous quarter to students who are not eligible for free or reduced price meals under section 1264A1B. So I'll come back to that section. That's the section where we actually expand the food program to pick up all students, and that's what the reference is doing. Then going up to, there's language before here that said that to the extent of, so that language here, sorry, that I just referred to by cross-reference is right here. Let's just read this. It says, not changed, but just for reference. It says, in addition to providing free and reduced lunches to students who qualify for them, in addition to that, each school board operating public schools shall cost to operate within each school in the school district the same school lunch and the same school breakfast program may available to students who qualify for those meals to each attending student every school day at no charge. So that's what makes it universal, and that's what this up here was referring to. And then there's language that said that the cost would be borne by school districts, and that's been struck. And then going up to here, you may recall that we had exempted the cost of providing universal school meals. We exempted those costs from the excess spending penalty. But because now this would be funded by the state and not by the school districts, I've struck out the exclusion of this cost from the excess spending penalty because schools won't be in their budgets.
And that's I'd say probably the biggest change I think that has been put forward, and that's one in the end that will be decided by approps. And my inclination is to just send this down to Starr and Kitchell now being at the end of this meeting, just to get them to start to be thinking about this kind of thing and whether or not it's on the table or if they'd prefer to for us to do other things. So thank you.
Yeah, just to be clear, today the way this works is that the school districts do pick up some costs and they are not excluded from the excess spending penalty. And under this version of the bill, they would pick up the same costs as they've been picking up before, and they would not be exempt. So this is basically a status quo provision now, given that the funding would come from the state instead of local budgets. Then here we go into the changes from AOE. They wanted to, this is around reporting, given the fact that we don't have the same reporting by students who are from low-income families, given the fact that we have universal school meals, they wanted to have authority to basically adopt new forms to fill out to get to that same information. And all of this does is it had referenced, I believe it was schools before, or school districts. They wanted to expand it to say by LEAs, which is our SUs, school districts and schools. So basically, the change is around the scope in terms of how the definition will be used. And then they've added B and C. So the secretary would define student poverty for purposes of A, we talked about, B, student eligibility for various educational programs and benefits where economic need is a consideration, and C, collecting and reporting disaggregated and student level performance data as required. And changes in 2 and 3 again, just to add in these other entities, as well as school districts. Same here. So quite minor changes actually to this section, just making it a bit more expansive. And then this hasn't changed. We get to the big part here, which is appropriation. So this says there's appropriated to the Agency of Education from somewhere for fiscal 22, the amount of somewhere between 25 million and 50 million for universal school meals. So this is where it shifts from local budgets to the state. I'm not sure where it's coming from, but that's just a placeholder for now. I think those are the only, oh yeah. And then we took out the annual budget request here. Usually, when I draft, usually it's a 1-year appropriation, and then it's supposed to be going on for further years afterwards. I usually ask the agency to bake that into its annual budget request, but Senate Appropriations doesn't like that. So I've taken that out. That's it.
Yes, Senator Chittenden.
Makes a lot of sense to me. So do you think the next step is to move it to appropriations?
Yeah, so Senator Perchik and then Senator Hooker.
I have a underlying question that I should know the answer to, that maybe somebody can, if nobody knows off the top of their head, I can go find out. But right now, the money that comes from the state for the school lunches is a per plate or per meal number, right? It's like $4.40 or something like that. Is that people know?
I believe so. They pay for the free lunches you pay by the feds, and then reduced is paid by, I think, in part the feds, in part by students, or would be, but the state comes in and pays that portion for them. I think it's based on a per plate kind of calculation, but I'm not positive, and the best person is Rosie at AOE.
Right. Okay, thank you.
So,
Yeah,
so, Mr. Demery, what would the responsibility of the school district then be under this new paradigm?
Exactly how it is today in terms of cost.
Okay.
So it's basically paying that portion of reduced lunches. I'm sure they have to buy equipment and set kitchens up and that kind of thing. They have those costs, but there are some state programs for that too. But whatever those costs are today, it wouldn't be changed because the expansion to universal school meals would be put on the state, not on the school districts.
Thank you.
Senator Perchik.
And wouldn't it also be, to sort of as a response to Senator Hooker's question, there's a freeing of responsibility? Like they won't have to collect the funds that they're required to collect now from the parents. So there's less required of them in the future. Not only is that the costs are the same, but the requirements are less.
I'm not sure about that because the state's paying for the parent share of the reduced price lunches. So I'm not sure what would change if that's what you're referring to.
Well, but they won't have to collect any money from any parents, right?
Yeah, because it'll be universal. Yeah, I think that's right.
Right. So they would free up the time that they spend collecting the money or chasing down people that don't pay or just accounting for that money and things like that.
But they would have to offer universal school meals when they don't today, and some schools don't offer anything. So I believe so they have to, at least get those meals to students.
Some don't offer meals. Is that what you're saying?
I think some. Well, am I right about that? I think Rosie mentioned that there might be a few districts that are exempted. Maybe I'm wrong about that, but
okay. But I guess they might have to offer more meals, which they talked about as when we talk about the cost, like they might have to buy another refrigerator or expand their kitchen if they're going to do a lot more meals than before.
Right.
So that's an obligation that they have, they
Yeah.
will have in the future that they don't have now.
And there's some grant funding in this bill to help that transition. Yeah.
Senator Hooker?
No, I'm all set. Thanks.
So we are, so again, and maybe there's just a lot of things going around in my mind right now, but just to clarify, we are now saying we're, if we were to move in this direction, rather than it being something that school districts would have to swallow, we're saying there would be state grants that would go toward universal school meals.
Correct.
And that, sounds great. I think that really is in the wheelhouse of appropriations. And I will check with Senator Kitchell to see what she might need from us, if anything, on this. Senator Lyons.
So the only question that I would have about that is then it becomes an ongoing expense. Theoretically, I mean, it could be a separate funding source that is needed every single year, becomes part of the base budget outside of education funding. So then it becomes, I guess the question that I would ask is, does it become susceptible to, let's think of a kinder word than rating, but, lowering the
No.
fund
Fair.
on a yearly basis. It's not covered regularly. The concern is that it wouldn't always be there. It could be taken away during the appropriations process. So
Very well put.
that's the only question I would ask.
Yep.
I mean, because there are federal dollars for low income folks, and that would continue to be available. And we know then that currently there are what was 78 schools that currently have all the meals covered for kids.
That's correct.
So hopefully that'll go up to 100% of the schools. But I can't imagine under dire circumstances taking food away from children. That may be the last place that I would go. So it'll be interesting to see.
Yeah. And then Jim, the other piece, if we're just talking about this in sections, are the requests from the Agency of Education.
Correct. Around the federal forms, or around the forms to be used for federal benefits. Yeah.
Okay. I think I did get a trickle of emails in now that we've made some of those language changes of people that might be interested in talking to us. And I will also, prior to continuing this in committee, see what Senators Starr and Kitchell might be thinking, and go from there. Any other questions, comments, concerns?